We have a reasonably compact agenda for tonight, although it's fairly wide-ranging. So I'll just open with, I believe, what's the first. Well, the first item is listed as an operational update, but if you don't mind, Cheryl, I'm going to just reverse the order a little bit and go with the state of emergency declaration, because I think that's pretty straightforward, and we might as well move forward with that. Any objection?
No.
Nope. Great. Oh, I see Mark just joined. Excellent. So in that case, I hope all members have had a chance to read the declaration. It was passed by the Board of Selectmen. It was prepared by Town Council, it appears. I'm pretty sure that's correct. I mentioned that to say the probability of us making changes to it is modest. So unless there is a significant oversight, error, or remission, I would anticipate that this is going to be the final form for the declaration. With that, I would like to open it for board discussion. So any member of the board who wishes to comment, please do. Anyone?
When was this sent out? Sorry.
It was sent out this afternoon, Mike.
I haven't had a chance to review it.
Okay. So, do you need a minute, or you want us to put it toward the end of the meeting, or?
Do you have a copy, Bill? You could just read it.
I could. It's actually on your screen right now.
Yeah.
Are you on video, Mike?
Can you scroll down a little bit? And a little bit more. Okay, thank you.
All right. Any comments, Mike?
Nope.
Well, in that case, I'm just going to go across polling the members in the order they're on the top of my screen. Mr. Conaby.
The only question I have, you can pull back, Cheryl. I think it said as of March 10th.
It says on March 10th, the governor declared it.
No, go down to it. That's all the whereas, which really is not the point I'm looking at. If you could, there we go. Basically, in the declaration, the now thereof section, it says we declare as of March 10th. Do we want the declaration to be March 10th, or do we want it as of today?
Well,
Go ahead.
so if you notice, the date for signature is dated 2 days ago as well. So I believe that I'll take some liberties here. You can, I know you're the attorney, you can comment, but I believe we were all in agreement with the governor's declaration on March 10. When we got together 3 days ago, we effectively declared a state of emergency with our endorsement of the closure of the public buildings. That was an emergency action due to the state of emergency. So I guess what my opinion is, the board was in alignment with these dates and practice. Given the difficulty it would take to get this changed, and I'm not sure what the benefit would be, I would recommend we just go with what we have.
Yeah, the governor declared it as the 10th, so it does seem that it would be appropriate to do that. I'm not sure about the date being the 17th.
But like I said, we effectively did it on the 16th.
Yep.
Bill's date was changed to today's date for signature. This is a copy that I received before that change came.
Oh, okay. So there we go.
All right, sounds good.
Dr. Taylor.
I agree with the statement.
Very good. I got to scroll over. Mr. Cruz, I think we've already heard from you. Dr. Jacoby.
Yeah, wait, just Bill, one more comment. Can we electronically sign this thing rather than wet signature? just to prevent, like,
So my anticipation is we're going to need to do a physical signature, but Cheryl and I have already worked that out. You know, it's going to be a fresh printed copy that gets put on a table. I'm going to walk up and sign it with my own pen, and then you know, she can pick it up with gloved hands if necessary and handle it from there.
yeah, maybe do it outside with, you know, the sunlight and UV rays on the document.
And a strong breeze.
Okay.
All right.
Or you can sign it and scan it and send it to.
Yeah. Yes, that would be another option. But yeah, I think the town is looking for an original signature. So I mean, I think we can do that with minimal difficulty. So I apologize, Dr. Jacoby. I think you were up.
Yes, I agree with the statement. I was just interested, are there any other powers for this other than putting down buildings?
Well, so I'm venturing into territory I don't fully know, but this is a declaration of emergency, which then enables certain actions by the town and the Board of Health and the Board of Selectmen. What the limits of those abilities are, I don't know, but I don't think they're confined to just shutting down the public buildings. I think we're going to get into that a little bit later tonight because we've got some situations I think we need to address, you know, in terms of businesses and so forth. So we'll be testing those limits perhaps later tonight.
Okay, good.
So my screen just decided to move itself back. Ms. Becerra.
I agree with it, and I have no questions.
Very good. I believe that covers everyone. That's Rika. I heard your voice. I apologize, but I don't think you were commenting. Did you have comments?
Yeah, I agree with it.
Okay. In that case, this would be the time for a motion if any member cares to make it.
I'll make it.
I second it.
Very good. Rika, I apologize, but in this particular case where we have a full board,
Yeah, yeah.
might-
I realized my mistake.
it's not a problem.
I'll be happy to make the motion or second it, Bill.
Very good. So that's Mr. Conaby. And Dr. Taylor, you're still seconding?
Yes.
Very good. Motion is made and seconded. Is there any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Okay, I've now just hit the problem of a virtual meeting. I'm afraid I'm gonna have to do it as a roll call, but I'm gonna work this backwards. No, I can't because my screen won't let me. Mr. Conaby, you're an aye?
Aye.
Dr. Taylor?
Aye.
Mr. Cruz?
Aye.
Oh gee, this is not helpful. I think I skipped over Joanne. Yeah, there you are. Joanne.
Aye.
Very good. And I also am aye. I believe that's everyone. I didn't miss anyone, did I? No, good. Okay, all ayes, motion passes unanimously. Excellent. Well, given that, we can move to the operational update from the director, which is actually the first item on the agenda. So, Cheryl, this would be your opportunity to let us know what's happening and what things we need to address.
Okay, I'll start with everything that we've done since our last meeting. So, since the last meeting, we reached out to a lot of businesses in Acton, including the daycares, and I think all but two were closed. You probably have seen the recent update from the governor that is ordering all daycares closed by the end of the day on March 22nd until April 6th. So that's the latest on that. We put out a blast to all of our residents, encouraging them to, follow all the procedures we've been talking about, the social distancing. We also threw in the wash your reusable bags, so we got that word out as well. Matt has been working diligently to all in an email acknowledging that they were going to be open for takeout only. And the ones that didn't, we reached out and made a phone call too. So everybody's on board. We also, after our meeting on Tuesday, reached out to the people that had the grocery stores or the convenience stores that had any kind of self-service or cold bar or hot bars, and we notified them of your decision to ban those for the time being. So they've all been notified as well. The fitness centers, some are open, so I guess that can be something that we might want to discuss later on. One karate studio is open that I'm aware of. The tutorial type schools that we asked to close on the last meeting are closed. So, it seems like people are in, we're not having any negative feedback, let's say. It's all positive and doing well. Hair salons, we reached out to them as well, and we told them, the protocols. And then
Pardon me, Cheryl. I apologize.
Yeah.
I just didn't want to lose the thought. Anecdotally, I've heard that the Russian math school is still open. Is that? Did they give you affirmation that they're closing?
I've called them twice, and I have not received that positive affirmation. No.
Okay.
So it seems like we might need to.
Then we'll have to. I would suggest that as part of your update on Monday, let us know, and we'll decide what our appropriate response is.
Okay. Okay. So hairdressers, quite a few are closed. Quite a few are open. One hairdresser in particular had a valid point. We told them to keep their stations 6 feet apart, have a disinfectant schedule, not to share common items. But then, the point being made, a hairdresser cannot stay 6 feet away from someone cutting. They cannot stay 6 foot away from their customer while they're cutting their hair. It just doesn't work. So I think we need to have a discussion about that. Positive.
Cheryl?
That's something new.
I don't think that's
yeah.
quite accurate. The briefing today with the governor's order was they could notify the appropriate EMS person of an address where an occupant has tested positive, but you could not release the personal identifiable information, including the name or age or other information.
You're
So I think it's really critical. That's been a hot point in the briefings. It's just an emergency order, and that information ends at the end of the emergency situation, and it's just the location, no other information. But this was pointed out. They certainly can ask the people when they get there to provide an update. The individual can release the protected information, and they also suggested that if they go to that address, they have one first responder in appropriate PPE, assess the situation before having the whole team based on the limited PPE that's available.
Yeah, Mark, you're absolutely right. I misspoke. I know. I have it circled right here. It's address only. Yeah.
Yeah, I think if you could just forward that on to the police and fire personnel would be great.
We actually
wanted to be clear because it's been an issue of contention with a bunch of other folks in other communities.
Yeah, they forwarded that to us this morning, Mark.
Excellent.
So the police and fire are aware of that. I think, I don't know, a feel-good thing is the schools are opening up from 11:30 to 1 on weekdays, and they're providing bag lunches to our residents in need, which is a good thing. You probably know the Board of Selectmen voted to postpone town meeting, and they're seeking a court order to delay the town election and the state special election. I think that's it that I have. I think some of the points I brought up we have to talk about a little bit deeper.
Okay, well, in that regard, let me open the discussion of things, personal services type businesses like hair salons, massage, so forth. It seems just in my reading of the press, available press, that states, we have 50 states and there's 50 different approaches to how they address such things. Has there been any guidance that we're aware of from the state as to how those types of businesses should be handled?
I haven't seen it. I have seen what some other communities have done. Some communities have just downright banned fitness, hair salon, a massage, body work. But I haven't seen a lot that have done that, but there are definitely some. And we have not, like I said, received any guidance regarding those from the state.
Bill?
Yep.
There was, during the update this afternoon with DPH, they did say that they're in the process of issuing guidance, but that they would defer immediately to the CDC recommendations in the governor's order that they maintain the 6 feet separation. And as it was pointed out by one of the folks there, it's very difficult to get a massage when someone's 6 feet away. So the point being is, it's anticipated that those activities will be banned, but they do, according to their information, they do not meet the recommendations of providing the social distancing and minimizing contacts.
Okay. Let me just ask if other members of the board have any opinions or information to share. Okay. Everyone has their mic on mute, just pointing out. So if you're commenting, we can't hear you.
Bill, just one thing I want to mention. I forgot to mention nail salons too, because they can't be 6 feet away.
True. Well, I'm not hearing other comments from members of the board. I guess what I would have to say on balance, as Mr. Conaby says, it's impossible to maintain 6 feet separation. I understand that personal services could probably help people in this difficult time, getting a massage or having, a enhancement visit of some sort, hair, nails, whatever, could be help relieve stress, and it certainly provides employment for the people doing it, which I'm very sensitive to, but with asymptomatic transmission being something that's very much of a concern, there's no way to know if your client or your service provider is in fact infected. And if the goal is to prevent infections, because again, particularly if we can't know who is infected, we have to assume everyone is. And we want to separate everyone so that whoever is infected, it stops with them. I don't see a basis for having those businesses continue to operate. So I would be very interested in other members' opinions.
Hey, Bill, sorry. Does this include like doctors, physicians, dentists?
So Dr. Jacoby was nice enough to share with us that I guess is it the American Dental Association?
was the Massachusetts Dental Society sent out a message. It wasn't a mandate, but it was a very strong suggestion, recommendation that all dentist offices shut down until the beginning of April. I do know of a couple of offices that are open, but for the most part, those offices are shut down. When you're working on a patient in close contact, I'm sure you've all been to the dentist at some point, there's all kinds of aerosols that go back and forth from the machines and from the people themselves. So it's certainly a good idea to not allow dental offices to open. If we can mandate that they not be open, I think that's a good idea. If we can do that, I think most medical practices are limiting everything that's not elective. If you had an appointment, they're canceling your appointment. As far as other people who work in close contact, it's not quite the same as a dental or a medical visit, but you are standing next to somebody and presumably spending about half an hour, 45 minutes with them. So I think it's reasonable that we shut down, or at least recommend that those types of services not be allowed in the town.
Thank you. Mr. Cruz, I guess I would offer to your point, which is certainly if it's an emergency, like even in a dental case where somebody fractures a tooth or has other dental emergencies, or if there's obviously a health emergency, then the rule shouldn't apply. Right? We're talking about I'll call it elective or discretionary type activities, such as getting your hair cut, getting a massage, having your teeth cleaned, things that we can postpone for a few weeks.
Yep, understood.
Bill, this is Bill Taylor. It's easy to take a look at the professional services, and but I'm also concerned in general. People on the streets who are not respecting the 6 feet difference, and in the community in general, whether there should be some clear messages there. I don't know that there's an enforcement message, but there's going to be a lot more of that than there is people going to a dentist or, for a massage.
I agree, Bill. You're right. Hopefully, the contact time, the duration of passing other people in the store or something is small. You can still, I'm sure, be infected. I guess part of my thought process on the businesses is someone I think just said, you're in contact with someone, you're cutting their hair, cleaning their teeth, whatever, for let's call it 30 minutes, and in very close proximity, so much less than 6 feet. Your head to head distance is maybe a couple feet. So, and for a while. So that's why I guess your point is well taken. We've got to try to really change our culture, get the socialization message out there that, this is a new way of behaving. It's not that you're being unfriendly, you're just being safe.
Right.
But in terms of concrete steps that we could take, this would be one. So that's why I'm sort of recommending it. No, I'm not sort of, I am recommending.
Okay.
I apologize. Rika, do you have comments?
I have similar concerns. I also think that if something is not essential, then people can wait rather than going for a haircut or nail salon. Because if if it is an emergency, like you said, if somebody breaks a tooth or something like that, then they should be checked with the dentist. But otherwise, I don't think it is essential. But I agree to your point also that obviously these people need to make money also. So
Yeah, and that's like,
nothing new from my side.
right. Well, I don't. This is one of those things. There is no perfect answer. I'm just gonna. We haven't called on Joanne very much tonight. So Joanne, do you have comments?
No, nothing that hasn't already been said. Although, when this is all done, we're all going to be in desperate needs of haircuts. Well, some of us. Sorry, just trying to be funny. And just to touch on something that I think Dr. Bill said earlier about folks out in the public. My husband walked by the Douglas playground / basketball courts yesterday when he was walking alone. And there were a bunch of high school or college kids playing basketball. And, he asked, well, did the town outlaw that? And who's enforcing it? And blah, blah, blah. So I think as we, move forward with what's going on and any other actions that we or the Board of Selectmen take, obviously the police department has a lot to do, but I think in spite of all the messaging that we're all getting, not everybody is taking it seriously. So I don't know if that's something we can address or something the town as a whole, the town being the Board of Selectmen, other folks take notice as well, but not everybody's heeding the warnings, essentially.
No, I get it. I mean, the town closed town facilities, which would include town-owned playgrounds, but it seems to me that, Cheryl, maybe this is yet another action for you, but should call the school department and say that schools closed means playgrounds are closed too. And they should put a sign on the playground that says, or this, outdoor recreation area, this outdoor recreation area is closed. And if people choose to ignore the sign, then they're trespassing. I guess police can address it.
I actually had a conversation today with the deputy police chief. A woman had written to them saying the same exact thing that you're talking about. The school had children playing basketball. And he asked, because it's clearly written that the Board of Health enforces. So we had a little chat and I asked them for their assistance, so they seemed open to that. Like you said, I mean, it's hard for me to have an employee be driving around town, breaking up, basketball games when we have, so many other important matters. I'm not saying that that's not important. So I think we are going to work together with the police to try to get the word out to when we see events like that.
I think the signs is a good idea. So, it's quite possible that they weren't aware that it was closed. So, then they can't claim ignorance at least.
Could you contact the schools to send out that messaging as well?
Absolutely.
So, Mike, I'm not sure if you would have a chance to fully express your comments. Do you have any other things you want to share?
Yeah, I do. So I've been monitoring the number of cases in Mass on the mass.gov site, and as of this morning, it was 256 cases, and tonight it is 328. So we're in that exponential period. So anything we can do to help the residents of Acton, I think, is important.
Yes, I would add something to that. As testing increases, there'll be more positives. And it won't be necessarily because of more transmission. It'll be more people just being identified positive through the test.
Yeah, agreed. Well, in order to give Cheryl some, I'll say, backing, if she's going to need to contact these businesses and tell them they're closed, I would suggest that this should be a vote of the Board of Health. And it might make sense, and I'm just throwing this out there for discussion, it might make sense to not make it as of 8 o'clock tomorrow morning. It might make sense to say, well, you know, there's some period of time where you can see your appointments and notify the people, say, for the weekend, Monday, whatever the right day is, that you're not going to be able to, you know, honor their appointment because you're closed. So on a Saturday morning or Monday morning, something along those lines. But that's really up to whichever member would care to make a motion if someone is so inclined.
So Bill, I don't know how you want to proceed, but we do have a person with their hand raised in the public. So I don't know whether you want to talk to that person before a vote or you want to do the vote and talk.
No, I think having public input would be great, please. Ask somebody to go ahead.
Oh, all right, hold on. Hi.
Hi, Sarah Fredericks with Acton. I agree with everything you're doing. And I hope that the sign on the playground includes sufficient details to scare the heck out of these kids and tell them it's not just them getting sick, it's about them carrying stuff back to their loved ones. And also, if, and I figure you're going to vote this in, I hope that you also vote in a fund to pay for these very, very low-income people who are working at these salons. I mean, even a few $100 each, $500 each, they got to pay their rent. There's the Elizabeth White Fund, and I know that there's got to be actuals, or there's got to be money in there someplace. And if you want help finding it, I will. But I think that it's a time, especially in a state of emergency like this, where the town should be funding individuals. Thank you.
Thank you, Tara. I just offer Mr. Martin from the Selectmen is joined our meeting. The Board of Health has no money. We have no control over any funds, but that's not true for the Selectmen. So I'm sure he'll carry that recommendation forward. But as I mentioned before, you know, it's with a great regret that I would propose this. But I think it's a case of, you know, we have to look at who the most good that we can do. Where is good? Okay, with that, go back to members of the board. Anyone wish to proceed with the motion? Or would you like to discuss the effective date? Well, I'm going to ask then.
I think an effective date of Saturday would be reasonable, giving, as you mentioned, businesses a day to contact their customers and let them know.
Okay, thank you, Joanne.
Bill, it's Mike. I would say do it as soon as possible.
Okay. So if
Can I mention something else, Bill?
yes, please.
I know that we have a golf course in town which is opening. I'm a member of Butterbrook. I was over there this afternoon having a conversation with them. And there are several things that the Golf Owners Associations are recommending as far as maintaining the health on golf courses. There's a couple of things. One is the flag stick should be left in at all times and not handled and taken out. Another issue is range balls should not be picked up with your hands, just moved around with your golf club. And they're also recommending that if the course is not too busy and it's feasible, that you should only have one person at a time in a golf cart.
Okay, thank you. Cheryl, I don't know when to file things on, but if, we could just ask that they post those recommendations and see if the members will, try to get compliance from the members. I don't think we can patrol the golf course, but I think most people understand the reason for it.
We've seen some criteria for both, as Dr. Cody mentioned, for golf courses and tennis. Those are really the only two exceptions.
I'm getting a very bad echo.
Yeah, I was just going to say, everybody can put their audio on mute.
Dr. Jacoby and Mr. Martin, I don't see that you're on mute. Oh, there's Mr. Martin. Rika, if you mind muting, please. Okay, well, we are now to the point where somebody should please unmute and make a motion.
I move that we, is the word order? We guess we're ordering personal care businesses to not to stop providing services to customers as of 8 a.m. on Saturday, March 21st.
That does not apply to home health or nursing homes, I presume.
Correct. I think I'm assuming we're talking about nail salons, hairdressers, barbers, massage therapists. We didn't talk about chiropractors, but do they fall in the same thing?
Yeah, I would say they're a licensed medical professional, and perhaps we could specify as being personal services that are not provided by medical professionals.
Yeah, I just think in the motion we should list the ones that we mentioned. You've gone through, Joanne.
Well, Dr. Taylor, I just offer the problem with that is that we'll never remember them all. So I'd rather do it, if it's okay with the members, I'd rather do it by exclusion, saying, in other words, if you're a medical provider, then you're excluded, but otherwise you're included. Because I don't know, I can't think of one, but someone, I'm sure, will come up with something that we just didn't think of.
Bill, I think one thing we want to do is this is for elective or routine, but it would not include emergency. So like a dentist could do an emergency procedure to get someone through. It's the routine cleaning. So I think we need to be clear that it's personal contact services where there's direct physical contact for an extended time.
Oh, okay.
So are we including dentists in this?
I think
Motion?
we have to, no?
No, I wouldn't suggest that.
Yeah, I would say no as well. That if we exclude licensed, medical care providers, that would be doctors, dentists, I guess, chiropractors, physical therapists, home health aides, nurses, like that.
Well, I guess who is to decide that something is essential?
Right.
My recommendation would be to do what I've seen some other communities do and actually list, say something like this includes, but it's not unlimited to hairdressers and barbers, nail salons, massage services, body art, body work. And then we can put like another disclaimer on the bottom that says this does not include, and then we can list those out. I don't know. That would be my recommendation. It's going to be like I forget who just said that, Mike. Or it'll be hard for us to sit back and make sure we got them all. No?
So that sounds reasonable approach that you can say includes but not limited to, which then says we're not just limiting it. And as to Mark's and Mike's point, I think, which is, we should exclude necessary medical visits. Who decides whether it's discretionary or not? At some point, we have to leave it up to the medical professional to decide if it's discretionary. I would.
It's the provider who decides that.
Yeah, the provider.
Provider decides that.
Yeah.
Bill,
What?
two things. Do we want to still have the situation where we're saying that elective routine, dental cleanings and would be something which would be canceled? Or do you want to leave that up to the professionals to their own discretion? And the other other things you mentioned, karate.
So that's, I would say, distinct from what we're, Mark, to answer your question. My view is that's distinct from what we're talking about right now, which is sort of one-on-one personal services, whereas the karate is. But I think we had discussed earlier in a meeting tonight that the things like karate studios are strongly encouraged to close, and if, in fact, most of them have. Cheryl is going to follow up any outliers tomorrow. And Joanne, you were good enough to make the motion, which did stimulate discussion. Would you be open to amending your motion to include some of the things that Cheryl?
Yeah, I've been taking notes. Let me see if I got it. So I move that we order closed elective personal care services, including but not limited to hair salons, barbers, nail salons, body art, massage therapists, and excluding care provided by licensed medical professionals.
Can I just add one thing to add to that? So all services, maybe start that with all services offered to the public, which cannot be provided at a distance of at least 6 feet. And then but not included, limited to what you just, everything else you just said. I almost think we should add that one little sentence.
Yep.
Okay.
To the public.
All right, I think we got it. And then I saw a comment come in that said we should consider putting in an end date. I would just suggest that it should be concurrent with our declared state of emergency. If we end the state of, we can always end this particular thing sooner, but it will certainly cease if the emergency ceases.
That sounds reasonable.
The emergency order shall remain in effect until notice is given pursuant to the Board of Health's judgment or something like that. And
well, no, the emergency declaration we just made, just say it'll run concurrent with that.
Concurrent with that. Okay.
When that ends, this will end for sure, if not sooner. Okay. So let me ask the other members of the board. Joanne did a great job of restating her motion. Does anyone have any questions as to what the motion is about? Hearing none, I'll ask if anyone would care to second that motion. Come on, don't leave Joanne hanging out there.
I'll second the motion, Bill.
Thank you, Mark. All right, we have a motion made and seconded. Following the same procedure as before, I'm going to do a roll call. Dr. Taylor.
Aye.
Ms. Becerra.
Are you serious?
Mr. Conaby.
Aye.
I did not anticipate that.
I think I've covered everyone. I vote aye as well. With that, the motion passes unanimously. Sadly, but true. Cheryl, was there other items that you felt that you needed board support be able to go and effectuate.
I think you just gave us enough work.
I think you're right.
Yeah, I mean, we'll get on that, first thing in the morning. But no, I mean, those were really the only ones that I was concerned about. I think that's a pretty good, I don't want to say beginning. It's kind of like a middle where I guess it went, but yeah. It's in our, in our workers.
Agenda items. York, Heather, has been very patiently joining this call. She's obviously going to be highly impacted by events as they unfold. Heather, do you have anything you need from us or would like to tell us?
Hi, Bill. Thanks for all you're doing. To all of you members, this is just such good information. I have a couple of just updates that I think we've covered some of it related to where the Massachusetts cases have gone up 72 cases positive as of today, 24-hour period. We do not have any positive cases in Acton, which is great. We do have 3 cases under quarantine, but they're not positive. It's just things that we're following on. The numbers keep falling, but I feel as we progress, we will. And I agree that part of that is because there will be more testing. As more testing happens, we will have more positive cases. More positive cases within the state will have contacts that may or may not be in Acton. So there definitely will be some additional follow-up on disease surveillance. Thank you, Cheryl, for mentioning the executive order from the Commissioner of the Mass Department of Public Health. That really makes it a lot easier for the boards of health across the state because it takes some of the pressure off. There's been a lot of pressure about emergency personnel, which is completely understandable, who have concerns about going into homes that they don't know what they're walking into. I know they've stepped up on their questioning. When one is called, the dispatchers have a list of questions that they're asking specific to COVID-19. But there's still that pushback monitored within town, who's a positive within town. So that's great that came out actually as an executive order to, again, as you folks talked about, it is only addresses. No other identifying information can be given out. And it's only for the positive cases within town, which thankfully we don't have any as of now. I'll just give you a quick little update of our planning within our department based on disease surveillance, if that's okay.
Sorry. I had to unmute. Yes, that would be good.
Oh, sure. Thank you. So in response to the questions and the conversation we had the other night about drive-through testing, because I'm sure that's on everyone's mind as we move forward, we're working on and looking at preparations for that. Our only concerns and challenges right now, which is a big challenge, is that as a Board of Health, we do not have any PPD equipment specific to COVID-19. We're trying to get that. We're working forward to be able to have that appropriate materials that we need. And, I'm working with our medical supply companies. Hopefully what the state is doing, working on the federal level to get those supplies released, that will open that up so that it won't be a problem for us. But as of now, we don't have that PPD equipment that we need to actually test people. And also, obviously, they haven't gotten to that point where they're sending kits out, where kits are available. So when and if that happens, I'm hoping that we've gotten that PPD equipment to make that happen. We're also working on a contingency plan for our employees as a home health department, board of health, nursing, that if anyone is out or unable to work, what do we do next? So we're looking at that. And then we're also planning and preparing for an increase in disease surveillance. We did get a call as a home health agency yesterday from Emerson Hospital asking if we would be open to taking patients who are COVID positive, who are being discharged from the because they're sick, if we would take these patients on. Now, my understanding from the conversation that another nurse had with them was that they're not going to be doing any continuous based on the guidelines of DPH, that there be 2 negative COVID tests within a 24-hour period. They're not going to be doing that. They're just going to be sending people home. And in conversation with Dr. Knights, Edwin Knights at Acton Medical, who is our medical director for the nursing service, he agreed with my initial response is that we would love to take these people on, but if we don't have the PPD equipment, how do we do that? Can we do it telephonically? Can do it telephonically? Absolutely. We would, follow these folks as they come out and they're stable and they're in their homes. But if there's someone that has to have a face-to-face assessment, until we get that PPD equipment, I can't commit to that. And Dr. Knights was completely on the same page, because it would just put our staff at risk, but it would also put other patients at risk. Expo service currently, who typically most at risk in the community. The things we've been working on our end.
Okay, that sounds very good. Just a quick question, although I suspect you've already thought of this. Does anyone else in the town have the PPE, like does the Emergency Management Agency, the fire department, any of those folks have a store of equipment?
So the EMS folks, I know from the fire chief, we've had multiple conversations about this. They have limited supplies. I would be really hesitant to take anything from them. Within the state, I think that's just going to continue to happen, and I think it's going to. As a clinician, the EMS employee access to that medical PPE equipment, just who's had a fever, who's had a cough, who has respiratory symptoms. I think those calls are going to start happening more frequently, unfortunately. And they are limited. They're working on that piece of it also.
Okay.
To get that equipment.
Yeah, that makes complete sense.
I'd like to just make a comment to that. I think, basically hospitals tend to justify their high readmission rates. And I think the hospitals need to take into account the personal situation of a positive case that they're considering sending home, and their ability to take care of themselves.
I completely agree with you, Dr. Taylor. I think that I don't know what other agencies' answers are, but the discharge planning department was calling agencies to get a yay or a nay. Can you take these people that we're sending home that we don't know are now negative? I really inability for healthcare workers within the state. I mean, the hospitals are having an issue to begin with about PPE equipment. I don't know how they can send people home and justify if they're not stable enough to take care of themselves, if they don't have any family or how without any it's a really tough question and decision to make.
Yeah, we're unfortunately being faced with a lot of those. But we just got a comment that came in from a member of the public who asked if any of the businesses in the community, particularly mentioned Insulet, might have a store of PPE that some other mechanism.
So that's a really interesting question because the town manager and I discussed this yesterday about, Insulet or other companies within town that may have that personal protective equipment that we could use. So that's definitely a good question, and we are looking into that.
Okay, great.
Hey, Bill.
Hey, this Mark.
Few quick comments based on the DPH briefing today, which they're doing every Thursday. They suggested the towns, if they're looking for additional personal protective equipment, to contact MEMA to notify them of their list so they can get on the list for future shipments and for the need and for sharing. So I would recommend that. You mentioned the testing to clear the patients. There's new CDC guidelines, and they're not going to require 2 tests more than 24 hours apart for everyone, assuming when they're asymptomatic, plus the 14 days that would allow them to be clear. So that may be that's something which is changing. Getting back to testing, there are now private testing. I guess it was going to be one case in Worcester. They're talking about doing drive-through testing at like a CVS. I would strongly urge reaching out to the pharmacies and medical people about if they're going to do a drive-through testing program to be coordinated with the health department and the nursing service. And obviously, they would have the PPE and maybe it could be shared. The other comment they made is that they strongly urge folks to basically push forward their planning for the Medical Reserve Corps and for reusing the PPE as appropriate. So those are kind of a lot of the comments. And then the last one about the necessary resources are limited for protective equipment. They were suggesting that obviously do as much as you can of the assessment prior to entering a facility, house or any other facility or closed space with proximity to a potential case. But in that particular situation, they were suggesting having one person gone up rather than the whole team, so you don't waste those resources. So a little bit of additional planning was suggested to deal with that, because they are getting a lot of calls from communities where folks are negative or they're just nervous, and obviously they need to assess the situation and preserve those resources and make sure it's being appropriately delivered. Thank you.
This is Bill Taylor. I did want to follow that remark by Mark, because 14 days is from when you're first concerned that you've had a contact. It takes roughly 5 to 6 days to become ill, and the illness lasts approximately 6 to 8 days. So the current recommendation is a contact who is well is isolated for 14 days, and then they're no longer contagious from coronavirus in 14 days.
Okay.
if I could make a comment on that topic, the guidance I received from the Department of Public Health yesterday, yes, there is going to be drop the 2 negative cases, but the guidance right now is if a positive COVID-19 case is without fever for 72 hours without using any kind of fever reducing medication, and it's 7 days past when they initially had, those are sort of the changing people off quarantine.
Okay, I saw that as well. Obviously, it's an evolving situation. I saw an article tonight just before the meeting that Hong Kong has now reported a second case in a dog. Very rapidly changing situation.
Very rapidly changing situations.
Well, thank you very much, Heather. Is there anything that you need us to do, or that we can, make a declaration, or in some way provide you with a legal support that would make your job easier?
I think what you're doing with your last vote of closing this is my opinion, the unneeded things that are happening in the community. I would love a haircut, but I won't make an appointment. So I think that's a really good move. So I a great job of keeping, moving forward and making those decisions, those hard decisions. And I think, kudos to Cheryl for all the outreach that they're doing within the community. It's a big job, and they're doing a great job at it. And I appreciate all your support.
Thank you. We appreciate your taking the time to come visit with us.
My pleasure.
And yes, and thank you to you and Cheryl. And so my very last one, this one I promise should be fairly short, which is restaurants have been severely disadvantaged because of needing to close down, but they are allowed to do takeout and delivery. And the Board of Health is responsible for regulating health or sanitary conditions in the restaurants. Is there anything that we can do either differently to support these businesses to help them at least, one, feed the community, and second, to maintain their business? Or are there special concerns that we should be worried about that we should have the health department looking at this point? Cheryl, I realize I just dropped that on you, so if you need to think about it and get back to us, that's fine.
My first thought, Bill, is there's so many initiatives out there now that people are suggesting they do, like have the restaurants offer takeout specials, and have some of them are also feeding the people who are in need. So there's a few initiatives out there, but while it really does break my heart, and I have had conversations with some restaurant owners that feel they're already on the brink, and it does break my heart. It's just a hard thing for us to work on at this point. I just think we need a little bit of time if that's the route the board wants to go, because we just got to get the public safety aspect into place, and then we can move forward with the items that can help our local businesses.
Okay, no, I totally understand. So let me just throw out one idea, and you can obviously fill in. We follow HACCP, right, which one of the things is time is an element of control. So, the time that the food is prepared and then wrapped and then, given to a person for consumption. guidelines, maybe there's something we can do to relax them or supplement them in some other way, you know, if the food is kept warm and again, like I said, I'm just throwing out ideas for your consideration in the future for what we do, just to try to make this easier, still preserves the, you know, health benefits, because we're in a kind of unique situation. So not for tonight, some other night.
Yeah, you don't want to loosen the standardized regulations, I don't think.
Well, but if a restaurant can keep the hot foods hot and the cold foods cold, then the time limitation doesn't go into effect. And if we can get, you know, volunteer groups to come take, like let's say, well, Roach Bar, they can't have the self-service anymore, but I guess if they're serving it, so let's say they cook up a bunch of hot foods and they're all left over and they maintain the temperatures throughout the course of the day, it wouldn't be a bad idea to get people to come pick up that excess food, distribute it to food pantries or anybody in need, just so, and then the time limit would start when they take it off the hot. But that doesn't really help the businesses unless there's a way to compensate them for that.
Okay. Well, thank you, Cheryl. I just want to, you know, be proactive in the sense that, you know, we put, we are, you know, the state, whoever, have put these businesses in a tough spot. If there's anything that we can do that makes sense to make that their current way of operating more, you know, efficient or beneficial, or, you know, we should look at doing that.
Okay.
With that, I've covered everything I'd hoped to cover. I'm going to ask one more time. I'm just going to poll the members to see if there's anything else that's you'd like to cover. So this time, Dr. Bill, you're first.
No, I've no additions.
Mr. Conley.
I guess just things in the future are to start doing some more planning for emergency actions, quarantine and isolation facilities, and a few other items, which I think we should probably look at maybe at the next meeting and get an update at that time.
Okay, thank you. And by the way, you just mentioned something I did forget. Our next meeting is this coming Monday. It's a regularly scheduled meeting. My intention, unless members overrule me, but my intention would be to also conduct it virtually. But there'll be no posting requirement because it's already been posted as a regular meeting. Dr. Jacoby, comments, last minute.
The other thing I was thinking about is how about all the kids' leagues, the baseball leagues, and soccer leagues? Are those going to be on or off or what?
They all, I think they all go with the school schedule, but we can make sure we notify the leagues, but I'm sure they're canceled, but I'll double check.
Good.
Dr. Taylor, I'm sorry, I already called your name. And Ms. Dr. Singh.
No, I don't have any other comment at this time.
Okay. Since we're being formal,
Just
Mr.
one
Cruz.
thing I wanted to share, like one of the doctors in India, like not one of the doctors, but a group of doctors, they treated 3 patients with anti-malaria, like the chloroquine, and 3 antiviral medicines. And all 3 of them, they were initially positive, but then they turned negative. And 2 of them were discharged. One is still in the hospital because he's diabetic and also has respiratory problems. So that seems to be a good news.
Yes, I understand and I hesitate to wade in here, but the president mentioned something along those lines at his news conference, that he thought that there were some treatment opportunities that were showing great promise, and may have in fact been referring to that. I'm not sure, but I know we've got a lot of very smart people working very hard. I'm sure we're going to start to get some good news for a change.
Yeah.
Mr. Cruz. Comments?
Hi, Bill. I'm just wondering, like a procedural thing, like, does the Board of Health have authority to mandate a shelter-in-place order?
So, Mike, I can just offer, when we last looked at this, which was for the avian flu, and granted that's been about 12 years ago, when we gave this a very hard look, the answer is yes. I believe we do. Now, that hasn't been tested by the courts that I'm aware of, but at the time when we prepared to have a very similar situation to this, for the avian flu, we put that out there as one of the things that, worst case, we would need to do, and nobody disputed it.
Can we bring it up at next meeting's agenda on Monday?
Well, sure, but how would you like it brought up? Would you like it brought up in the sense that you'd like to ask for town council opinion, or would you like to?
Do we need town council opinion?
Well, I guess it's one of those things I'd say it wouldn't hurt if we're going to actually have to make that step. And I mean, that's all I'll say is a fairly drastic step. But if we're going to have to do that, it would be nice to be able to cite the legal basis for it.
Yeah, but you can't.
Wait, well done, Dr. Bill. I think like Monday we're going to be over 1,000 cases of COVID.
There's none in Acton. You have to have
There'll be 1,000
demonstration of risk before you make that recommendation.
Yeah, but Dr. Bill, you said the same thing like Monday about like daycare facilities, and now they're closed by Governor Chuck
Baker.
Yep.
So, Mike, I mean, I guess what I'm hearing you say is you'd like to debate whether or not we impose that order, and that's fine. We can do that. It will be up to the members to vote their conscience as to what they want to do. I would just suggest if that's something we're seriously considering, it would be helpful to clarify the legal basis for it. So
can I make it?
And the level of risk.
Well, Dr. Bill, that will certainly be an item of discussion.
So the posting deadline for the meeting on Monday was today at 5 or today at 4:30. So it's currently not on the agenda.
Okay.
I mean, we can have a discussion like under like an update. It's a COVID update is on there. So I just don't know how deep we can go on Monday.
Yeah.
I think we can go fairly deep. It's an emergency order, but I think it would certainly be advisable to take one step at a time and see what DPH and others recommend. I think we need to look at what is the actual situation in the community at that time. But certainly requesting opinion from town council would be prudent. Certainly, what I've read is within the powers of the board, but it is, as everyone knows, an extreme order. So
yeah. Okay. Along those lines, then. So, Mr. Cruz, here's what I'd suggest. First, I'd ask Cheryl if you could ask the town manager if we could get town council's opinion as to the limits of our ability to impose a quarantine order. Second, I would suggest we follow Mr. Conaby's suggestion. We'll bring it up for discussion. If in fact it's advanced to the state where it really is, we've approached that threshold, and God, I hope we don't. But if we have approached that threshold, then we can always do it as an emergency order.
Okay, I can do that. We also have a hand raised from the audience, Bill.
Okay, I'll get to that in just 1 second.
Okay.
Just like to make sure I've covered the numbers. Joanne? Any comments?
Yeah, I'm all set. Nope.
And Mark, did I already ask for your final comments, or not yet?
I think you pretty much have. I think to get town council's opinion, it may also be if we get to that situation, which God hope we don't get to. The quarantine and isolation facilities and curfews and other things, I think, are some of the discussions for planning, not necessarily implementation, but something to be considered as we go forward, unfortunately.
I just want to make sure did I pass over you, Dr. Jacoby, or did I already? I'm sorry. Are you all set, Dr. Jacoby?
Yeah, all set.
Thank you.
All set.
Okay, in that case, Heather, sure, we'd be happy to hear from someone in the audience.
Okay, go ahead.
This is Tara Fredericks. I have some questions. With the shelter in place idea, and I don't necessarily need them all answered now, I just want to register them, but if you have a discussion, I'd be certainly willing to comment on the discussion. How would people get food? To what extent would you enforce the shelter in place that if a teenager won't get off the basketball court, will you shoot them if they run away? There doesn't seem to be enough police to personally police every single teenager, for example. And I worry that such a Marshall Plan, in a sense, may backfire. And so I urge you first to educate and strongly urge. Also, the shelter in place request or strong suggestion or whatever it is has only been in effect for a number of days. I personally wasn't even that worried until things started getting more serious. And when people started saying shelter in place, I said, okay. And I gathered all my food, and I'm sitting in the house here. And, I'd like to see what happens over the next few days to see whether, people going to the store are causing the issue. A few people on the basketball court, I don't know whether that's any worse than people going to the store. I mean, I was walking down the aisle and people were leaning into me and it's all I could do is stay 6 feet away from people. And so that led to my other questions, which I didn't get a chance to answer. So do I get a chance again to ask I have some safety questions that I want to ask the experts. But if I send you questions on email, do you get them during the meeting so that you can possibly discuss them or have input? I'm wondering how apparently somebody else gave you some input. I'm just sitting here hitting *9, *9, *9, and if I could email you my questions, that certainly would be a lot easier.
Okay, so I'll try to address those things in order, Tara, but we all completely understand that the type of very draconian restrictions that a shelter in place or a quarantine order involves would be the last step that we would take, and we'd have to be in extreme distress to do that, and there would be lots of unanswered questions. How would we provide medical care to the people that were sick? How would we get food? As you mentioned, and we'd have to work our way through those. But no one's, at least tonight, suggesting that that's where we are yet. As far as being able to comment, if you use the Zoom, what I was referring to is if you use the Zoom app, there is a way to send chat messages to the panelists. That's us.
Relative to public access to the meetings, and Zoom's stated their privacy policy, they reserve the right to steal the data. I feel uncomfortable, and I wish there was a different way. I like the idea of email because it is owned by the town, and I don't know how we could perhaps do that without my personal information going to Zoom so that they can sell it. But it would be nice to be able for the public to be able to comment. And anyways, so far so good, I suppose. But
well, so the approach, Tara, would be if you email it to Cheryl, she would be able to receive it probably during the meeting. But I'll just, so that you're not feel slighted or something in the future, is that would require Cheryl to see it, read it, and basically ask the question for you, and she may or may not be able to convey exactly what your meaning was. So
okay, I'll save up my questions then and wait for the star 9. One of my other questions is about using reverse 911 more often. For example, I had suggested this to Laura Deschamps. She had this wonderful site with all this information, and the fact that food is being handed out to effectively anybody at the school is wonderful information. And her response back was that the information's not. Like I said that it's a lot of people that, especially people in need, don't have access to computer or internet, but they do have phones. And so, but her response was that the information is on the website. So I don't know if she just read my email wrong or whatever, but that to reverse 911 to ask people to ask their friends for the respirators, for example, because there's like ambulance companies, there's companies that, like Hearts and all these companies that make stuff. They have these respirators, industrial level respirators in their manufacturing facilities. And I feel like there would be a great opportunity for like lists of needs, wish lists, things like that. There are mutual aid networks popping up all over the state. I think I sent you a link, and they are using Google Docs. They set them up so that anybody can look at them without cookies and signing in, so that's very helpful. And a lot of these communities are satisfying needs. Like, for example, I've got a thing of toilet paper in my plastic tub out here that anybody can come get, and when it's empty, I just put in another one. So I hope we engage in a little more mutual aid, and I realize you guys are on the front line and you're dealing with nurses needing respirators, but maybe using the reverse 911 a little more often might help. That's all.
Okay.
Thank you.
Thank you. Appreciate the comments.
Oh, I have one more question about the, if I go to the supermarket, how much risk am I in? In other words, if I can figure out how to stay 6 feet away, I've got my bandana on my mouth, on my nose, is this, do we not know, how much risk do we think that is?
Well, let's see. I think one of the doctors could comment, but Rika has got a particular expertise in infectious diseases. Would you feel comfortable commenting, Rika, or not yet?
Yes, you can easily stay away. Make sure that you are at far distance from other customers as well as from the associates, and this can be done easily by just making sure that you maintain your distance. So, and you can, if you cover your mouth, that's fine, but and the other thing you can do is don't bring your hand close to your mouth or eyes or nose, just to prevent any infection to enter through any of these orifices.
So would you characterize the risk as being low if I go to the supermarket, medium, or high?
The risk is, at this point, it is not that high, but the situation is changing every day. So make your visits as per requirement. Like if there's something that you really need, then only you should be going to the supermarket. Otherwise, why not get everything and organize it at home so that you don't have to visit the store very frequently, and that way you will be able to for yourself.
Thank you. My last question is about supplies. What's happening is that the shelves are empty of critical supplies, and everybody seems to be going to the store every day to look for them, and they're not there. I wish there was a notification system that lets us know when to come. And it's my understanding that some towns, like the CVS manager, is very kind, and you tell them that you want, an alcohol, and when it comes in, they reserve it for you, and they save it for you. So I'm just putting it out there, not asking for any answers right now, but if there is a possibility of any kind of coordination on supplies, maybe I'll do it myself and just notify everybody. I don't know. But just let you know. Thank you. That's it. Thanks so much.
So I believe that brings us to the end of our business for tonight. It would require a motion to adjourn from a member.
So moved.
Very good. Mr. Cruz has made a motion. Is there a second?
Second.
I hear Dr. Taylor making a second. This is non-debatable. So all those in favor of adjournment, please say aye. I will poll the members. Dr. Taylor.
Aye.
Mr. Conaby.
Aye.
Ms. Becerra.
Aye.
Mr. Cruz.
Aye.
And I vote aye as well. So the meeting is adjourned. Thank you all. I very much appreciate your patience and your forbearance with our rather unusual process, but hopefully we'll make it work. Thank you and good night.